Health, they say, is a state of physical, mental, and emotional well-being, and not merely the absence of disease or infirmity. Hello there, good evening, and welcome to Wellbeing. Of course, you know that Wellbeing is one program that keeps you updated on trending health issues and also gives you the latest advice on how you can go about your daily living. You know, recently someone told me I'm always very excited whenever I come on my programs, and that's very true because man, a lot is really going on in the 21st century that, you know, I get to question myself every day. And ever since I became a health anchor or a health journalist, trust me, I've been so careful about everything I do. Like, to even think that one of the ways to come down with a training virus is by just sitting close to somebody. Maybe probably if the person sneezes, you know, you could literally come down with the virus. Just gets me scared. I know that there is a part where God is our protector, God is our source, God is our healer. But there is also a part where you have to be very, very intentional and careful. And this is where Wellbeing comes in. You know, Wellbeing is a program that shows every Thursday and Sunday on Spectrum TV. And trust Spectrum TV, we ensure that we give you the best and nothing but the best. On today's show on Wellbeing, I feel like having this, you know, suspense, soundtrack. But then on today's show on Wellbeing, we are going to talk about this very, you know, overlooked problem going on in the society. You know, it's a problem because we make it look as if, oh, there's nothing, you know, there's nothing about it. And not just to, you know, brush your teeth or chew a chewing stick. Some people even go with that. I mean, some people just go like that for weeks. So I once had a conversation with somebody that said, I didn't even do it. I didn't even brush my teeth. I'm like, how do you survive if you don't brush your teeth? Anyways, on today's show, we are going to talk about the teeth. And I'm very, very privileged and happy and excited to host one of the most intelligent and brilliant doctors in the world. Trust me, when I reached out to her, she was super excited. And, you know, both of us, we kind of had the same energy. So if this was worship experience, I would say with Jesus' joy. But because this is Wellbeing, I'm going to go on a break right now to give you a chance to go pick your pen and your diary, because there is always something for you to learn. Dear mothers, call your children. Husbands, call everybody together, because in the next 1 hour or in the next 50 minutes, you are going to, you know, be updated on training health issues about your teeth. There is more in this mouth than just talking and eating. You have to take care of the mouth, because out of it, the Bible says, flows the issues of life. Let's go on a quick break. When we return, Wellbeing continues. Okay, welcome back. This is Wellbeing on Spectrum TV. I said today we're going to talk about the teeth. Yeah. When last... Let me shake this table a little bit. When last did you go to see a dentist? Apart from when you were a child. That is, if, you know, you grew up in homes that prioritize all those stuff. When last did you go to a dentist and say, please, I don't know what's going on, but I feel that, you know, something's not going on very well in my mouth. Apart from brushing your teeth, you know, in fact, let me just go down. When last did you change your toothbrush? Let's start from there. So on today's show, we are going to talk about the care of the teeth. And I said earlier that I'm very, very privileged to have with me a dentist who will guide us on this process. Let me just tell you, she has a very long Yoruba name. So I'm just going to keep it very simple. Dr. Tolu. Hello, Ma. Good evening and welcome to the show.
Hello, good evening.
Okay, so I guess while we are still waiting for her to connect with us, network, I swear you guys should never try me today because Okay, so while we are still waiting for Dr. Tolu to join us on today's show, I said earlier that we were going to talk about the care of the teeth, everything you need to know, how to brush, when to brush, what if I want to go and whiten my teeth to improve my smells, how do I go about it? On today's show, this is what we are going to, really discuss. And also, if I have a tooth decay, because there are some people that they rather prefer to carry, should I call, a wounded teeth in their mouth for so long than do you get even go to even see a dentist. And also the importance of, once in a while, once in a year, to just go to a dentist to say, excuse me, sir, I just want to see if everything in my mouth is okay. And there's some people that even have holes in their teeth. I'm going to shake some table, but I know that there's some people that have holes in their teeth, and, after eating, right, the food that they've eaten will now fill up the space, and they'll now use a toothpick to be picking it out. Yeah, don't feel ashamed. On today's show, that is what we are going to talk about today on Wellbeing. But previously, if you've been following Wellbeing, last week we got to talk about cholera, and, it was quite also an interesting topic where we got to discuss how cholera gets into the human body. I don't know if our guest is ready now, but let's find out. Hello, good evening, Ma.
Good evening.
Jesus, finally. How are you doing, Ma?
I'm very well, thank you
Okay,
for
so
having me.
okay, so I've been talking for so long, and I'm sure that everybody, we have been so eager to hear from you. I know you have this very long name that I find it very hard to, pronounce. So, with due respect, would you mind calling out your name for us?
Okay, I'm Dr. Patokun.
Sorry, what did you say?
Dr. Tolu.
Okay, Dr. Tolu, we are just going to hit the ground running. Now, today we are going to talk about the teeth, and I'm very happy that we're having this session because most people have never been privileged to have, a one-on-one session with a dentist. So my first question would be, what are the common dental problems that people face in our society today?
Okay. The dental problems with caries, that's the commonest thing. A hole in the teeth, so all caries, all cavity, holes in the teeth. That's the commonest thing you can say. Other things are gums. So some people come say their gums are thin. People come with complaints of they lost a tooth that was loose and fell off. Another common complaint is trauma. So the accident or a blow, or a fall, a stone or something hitting their teeth. That's another common we see at the dental clinic, and very commonly too, pain. So many people come to dental clinic because they have no pain, but if there's no pain, they will not be coming around.
Okay.
So those are the common situations with these common complaints.
Okay, so Dr. Tolu, I know you're very excited as I am, but it seems a little bit fast. So we are not we are not really picking your words. So I would like you to reiterate all over again, but this time around in a more calm version so that, some of us who are with our diaries can actually jot.
Okay, I'll take it again. So the common complaints at the dental clinic are, number one, dental caries.
Okay.
Which is hole in the teeth, a hole in the holes in. Another common complaint is loss due to trauma, due to the teeth just falling. Another common complaint is gum bleeding. People complain of bleeding. They can't explain, they just realize that their gums are bleeding. Another one is pain, which is quite common. Many people will not come over to that there's no pain. So pain is also one of our very common symptoms. Less commonly also, less common than pain, we have people complain of some swellings in the mouth, of their face. That's also another, and very important, bad breath. That's also a common complaint. And finally, this is not all encompassing. One is sensitivity. So complain of shocking them with cold or hot fluids. So these are the common things we see at common presentations we have at the dental.
Okay. Thank you so much, doctor. No, so I really want to know, how does cavity in the teeth forms, and then what are the steps that we can actually take to prevent it?
Okay, cavities form where bacteria. There's something we call when we brush our. If you notice when you brush your teeth, if you rub your nails, if you scratch your teeth, your nail, or I like some yellowish uh, on your fingers, even if when you just brushed like 30 minutes ago. So that's plaque. Not everybody, it's a biofilm that over time, the more we eat, the more our mouth is exposed to the environment, the more bacteria accumulates in the biofilm and it's plaque. So when plaque is in the mouth, it's rich in bacteria. So when someone eats sugary food, things like sweets, chocolates, food rich in sugar, polysaccharides, when we take food that are rich in sugar, and this bacteria acts on them, it tends to break down into to release this acid break down into smaller bits, makes it stronger than it's supposed to be. So we know the teeth is very hard. Enamel, hardest, but even hard bone. When this acid is, they break down the teeth and the teeth to soften, and that's when we say someone or has a hole of.
Okay. Wow. Wow. Thank you so much, Dr. Tolu. But now, no, my next questions will be on tooth decay. Now, what are the early signs that your tooth is about to, apart from your tooth falling off, what are the early signs of tooth decay that someone can look at their teeth in the mirror and say, oh, I've seen 1, 2, 3, 4, 5. I think I need to see a dentist, or I think I need to do maybe take any first aid to prevent my tooth from, getting ruined in the process.
Okay, so the common signs that an individual has caries or caries is starting, the first sign will be in some people there could be some changes. So a discoloration different from uh, the tooth beside it, or an area that looks chalky white. So when I say chalky white, you know how chalk is very white. So an area that looks very white compared to another area. There are some other things in the tooth that present that way, but that's one common. The teeth looking a little whiter than normal, chalky white appearance. That could be an early sign. It could also be discolored. It could be brown, a black dot, and just be feeling your tongue against your tooth, effect somewhere, just a tiny difference over the teeth. So it could be a change in color, which could be chalky white, which could be brown, or it could be rubbing your tongue against the tooth and feeling that there's actually a cavity that it feel like it's feeling before it feels like a space that food is. That those are early signs. Much later, uh, pain then sets in. Pain when eating. Some people only feel pain when eating. At that stage, it's reversible. When you're just eating and you feel painful, few seconds and it goes off. As soon as you stop eating, it goes. Those are still early signs. It gets to the stage where it's irreversible, where even when you're not eating, wake up from their sleep, the pain wakes them up from eating. So one know that going on. And in the extreme case, there could be swellings, facial space infection. So if you neglect the hole, you neglect discoloration, neglect the pain when you eat, you neglect the spontaneous pain that wakes you up from sleep, it can get to the level where there's a swelling in the face, and this can be like finally.
So, I don't know how many of you are just touching your teeth while the doctor is talking, because seriously, I am. That's what I've been doing while she was talking. So, are you saying that, wait, if I once had a brown teeth and one day I wake up to have, a part of my teeth white, that's just a sign that, something's going on wrong in my teeth? Is that what you're saying?
Yes, I'll start with caution because there are other who present with a distribution of the teeth. So those who have excessive fluid, they also tend to have distribution. But generally speaking, I would say if you see an alteration from the way you're looking before, maybe a little area is looking white, a pimple, you just see something tiny different from what it was before. brown discoloration, anything different from the way it was before, that's enough reason the specialist that will tell you what to worry about or not. And that's why we should have checkups actually more, so that things that stop in, uh, you are able to prevent sequelae in dental care.
Okay. Dr. Tulu, do you know that, you know, it's very, very rare, to be very honest. I have never seen somebody, okay, not like I've never seen, because I've actually had tooth problem before. But then I rarely hear people say, oh, I want to go and see a dentist. Now, the only time I hear people say they want to see a dentist is because they want to whiten their teeth. So now my next questions will be, are there any side effects to people who say, look, I want my smiles to be as cute as yours that we are seeing right now on the screen, and I have to go and make it a little bit brighter? Are there any side effects, or is that okay?
Well, we'll talk about teeth whitening. As with every procedure, there can always be side effects. There are possible side effects, but not absolute. It's not everyone that has whitening that has side effects. But some people come up with, people complain that after teeth whitening, they have a shocking sensation in their teeth, which was not there before. Or some had sensitivity before, which worsened after the teeth whitening procedure. Some other people complain that it's readily than before. So they take something colored, maybe take a bottle of salt that has blood over time, it tends to get discolored faster than a natural teeth would have gotten discolored. So the person that tends to come have the teeth. It's not a one-off thing that you just do today and you think your teeth to be white that way. It's something you have to keep doing. You keep coming for checkup, and if there's a need for another session to be done. So yes, there are side effects, but is it worth it? Considering, so it depends on the situation, how the teeth of the person was initially, weigh the pros and cons, and see if it's something you still want to go ahead with.
Okay, okay. Dr. Tolu, do you know, I don't know if you've seen it, but I've seen people who tend to, forgive me, I'm going to be very lay right now because I don't know how they call that stuff. But then I've seen people who, they kind of have scattered teeth. I don't know if it's called scattered teeth. And apologies in case, you know, yeah, you're watching me and then that's you know, that's the nature of your teeth, right? But then I've seen people who have, you know, teeth grow in, should I say, abnormal places. So I want to know, what are the causes of that? You know, I've seen an adult who just woke up one day and then teeth just began to grow at, you know, very abnormal, and then it made her mouth look very funny. So what are the causes of that, and how can it be controlled?
Okay. So first of all, right, called, so a deviation from the normal occlusion, a deviation in the normal way, the teeth will be arranged. So, truth be told, everybody has a form of malocclusion or the other. There's no one with an ideal occlusion. The best of us probably just have a normal occlusion where we have a very good smile, but nobody really has the ideal. So, what are the things that cause malocclusion? In heredity. So, if a first degree relative, a father, a mother, has malocclusion, has teeth, in layman, it's the likelihood of the children in that family having similar arrangement of teeth very high. Another thing is trauma, which is like accidents. If there's an impact, a blow or something to a teeth tend to move. Some people's teeth move inwards, outwards, forward, backward to trauma due to an impact, an accident, something. So trauma also to move from their normal position. Another thing that could cause is oral habits. Very common in children, adults. So children suck their thumbs and it's not them quiet, but it have full effects later on. So thumb sucking, tongue thrusting, sticking your tongue out every time. So people were not doing it, they used to keep themselves, they thrust their tongue out. That has an effect on that the teeth forward. Thumb sucking, which I made, notice that some people when they get together and smile, there seems to be a gap, that upper lower teeth, like a circle, like a gap a space between the upper and lower teeth cannot touch each other, and that's because people have been sucking their tongue over. And when they stopped, it was too late for the teeth to readjust back.
Wow.
Those are common things that pretty common people have malnutrition. Very quickly to how this can be corrected. So we correct malnutrition based on the cause, because if you don't deal with the cause, these things can happen again. So if it's a child that has a thumb sucking habit or has a tongue thrusting habit, we have appliances to keep the tongue back in place. We have what we call a tongue rake. There are lip balms, various appliances to keep the tongue backward and to stop the habit of thrusting forward. For those who it's due to trauma or any other cause, we are back. We make sure we deal with the cause. For those who are there's nothing you can do about it. You just need to correct them, and we correct them with braces, which we call orthodontic appliances. For what we generally but we call it orthodontic appliances. These are used for children and adults to arrange their teeth and bring it back to the way it's supposed to be.
Wow. Tongue thrusting could actually lead to... Dr. Tolu, I mean, how much is a trip to Las Vegas again? I think you deserve more. Thank you so much for that information. Yeah. But then again, Dr. Tolu, at some point in my life, I had this a decayed tooth, even I pulled it out. And let me just confess, I found it very hard to go pull out my tooth. So I said it earlier on the show, for no reason, Dr. Tolu, do you know that my teeth just started breaking inside? And whenever I eat food, the food goes inside there. And I found it very, very hard to go and see a dentist until after a while. Now, this is my question. What are the implications of keeping a decayed tooth in your mouth because of fear of, we heard stories of they will drag you. If you go there, they're going to inject something to your teeth and you will not wake up again and all. So what are the implications of keeping a decayed tooth in your mouth? And then what causes that hole in the middle?
Okay. So the implication of keeping your teeth without treating it, the implication of leaving a tooth, so just like even an infection, dental caries is a form of infection, or in the tooth, or leaving it there can only do harm, no good. It only gets worse. Earlier I was talking about the quality of dental caries. That's the hole. So if you leave it as a hole and you leave it there, what happens is that it gets the pulp, which is the life of the tooth, it starts to hurt. Once it gets infected, the pain sometimes and goes. At that stage, it's still okay. Nothing bad is happening. It can progress and get to the level where you have what we call a dental abscess. So the apical I don't want to go down it, but it can lead to a swelling. So you see some people that come to the clinic with big swellings on their cheek, and they just start paining me. But these people pain has been there for years, and they've abandoned it. They wake up in the morning and they see that it's very. That's what we call abscess.
Okay.
In something more serious than that, some facial that's areas of the face, and once it targets and it gets to a point where the individual stress. So cases that should help someone to breathe, considering that the mouth airway, it can lead to the tongue rising up, blocking the airway. So you see some people come into the clinic, they can't breathe in because of a toothache. And if there's respiratory distress, and that there, and yes, it's not die of I've seen it up, and it happens for real. So what happens to someone else that get into death if the person lives long enough to go through the process of the dental caries?
Okay, thank you so much, Dr. Tolu. We are going to go on a short break right now. When we return, Dr. Tolu, do you actually know that there are people who are allergic to brushing their teeth? And also I learned that there is a proper way of, making use of a toothbrush. So after the break, we are going to listen to Dr. Tolu guide us on the proper way to, take care of the teeth, and maybe reach out to some people that are super allergic to brushing their teeth, and also the dangers of not even brushing your teeth every day. Let's go on a quick break. When we return, we are still having this very serious, interesting conversation with our dentist, Dr. Tolu. Hello there, welcome back. This is Wellbeing on Spectrum TV. My name is Emedion James. And we've been having this very interesting conversation with a dentist. And I mean, she's been saying things, I don't know about you, but while she's talking, I'm literally touching my teeth to be sure. I hope I did the right thing as a child. Did I suck my tongue? I mean, I could never imagine that actually sucking your tongue could actually lead to you having, very funny teeth. And also, it's not like I'm laughing, but then one of the questions you have to ask if you're single is, hello, please, do you mind telling me the history of your family's teeth? Because it's very, very important. But anyways, the good thing that she said is that it can be corrected. So if you happen to have this issue, all you have to do is to go to a dentist. I know that it's very weird and very uncomfortable to tell somebody, I want to go and see a dentist. We only see doctors when we have malaria and all. But guess what? Going to see a dentist can serve you from drama and... Have you had tooth decay before? Trust me, you won't even wish it on your worst enemy. So going to see a dentist on time can actually, guide you on how to take care of your teeth, because your teeth are... Have you seen Dr. Tolu's smile? Like, it's quite contagious, and you can see and know why she is a dentist. Okay, so over to you, Dr. Tolu. Are you with us?
Yes, I am.
Okay, so while we are still waiting for our doctor to get connected with us, we're having this very interesting conversation on the teeth. And I said it earlier, that it is very, very important for you to go and see a dentist. Even though in Africa, we like to use chewing stick, and then you just use the chewing stick. Sometimes you use... Don't worry, I want Dr. Tolu to say it herself so that it will not look as if, I'm making fun of anybody. But then there is a way I've seen people brush, and if people were to, go and meet the Lord through brushing, a lot. I don't know, is there something inside the mouth that you are trying to clean? Because I am not understanding. Maybe I could be wrong, maybe I could be right. But then again, Dr. Tolu will have to tell us what is the proper way of brushing. So let me turn the MIC right now to Dr. Tolu. Hello, Ma. Good evening.
Hello. Good evening.
Okay, so yeah, I can hear you. Welcome back to the show.
Okay, thank you.
Okay, so Dr. Tolu, I was actually saying that, I've seen people... Hello, can you hear me?
Yes, I can.
Okay, so I was actually saying that I've seen people brush their teeth in very alarming way. Some people brush and they literally pushing all the toothbrush inside of them. Somebody can be brushing and you can stay at a distance and hear them trying to chew up. So I'm wondering, what is the proper way to actually brush these teeth?
Okay, so first of all, before we talk about how to brush it, we'll talk about what do we need to brush the teeth. So first of all, you need your toothbrush, not too hard, not too soft. A number of people tend to use this toothbrush that's focused. Wondering, why are you doing that? So first of all, medium brittle toothbrush, that's the texture we use. Secondly, you have to brush with fluoridated toothpaste. So before you buy any toothpaste, just check the ingredients and make sure there's fluoride in it. Now of brushing. When we brush away from our gums in a sweeping motion. So people tend to just brush haphazardly. That should not be. You have to brush away from your gum line. You're not brushing towards your gum line. You're sweeping from your gum line. So first of all, when you want to start, you open your mouth. After putting your toothpaste on your toothbrush, you open your mouth. Then start from the lower jaw up, whichever one you want. You sweep from your gum upwards for the outer that everybody can. For the inner part also, you sweep from your gum. So when I say gum upwards, I mean the lower teeth. For the upper teeth, it will be from your gum line downwards. After doing that, we have some teeth at the back, our molars. So you brush the surface of them. That's where you chew big teeth we used to chew at the back of our mouth, at the rear part. So we brush those surfaces, the upper and the lower teeth, the posterior to the teeth. After doing that, the tongue, we brush from back to front, gently. So we don't brush forcefully with the tongue. And generally, when you do it for about 2 minutes, we should brush our teeth, but not just do a second. And it should not be done with the toothbrush should do up the jet from gum line upwards, upper teeth, your gum line down. If you don't do it, that the individual's the gum starts to move upward, and time the person can start talking sensation. So the important we get can go online, watch YouTube videos, then practicalize how we work at.
Wow, thank you so much. I was literally, back here on the stage, I'm literally trying to be sure I've been doing the right thing. So, according to what Dr. Solu just said right now, you're supposed to sweep. You're not supposed to put the toothbrush instantly and be like, sometimes some people look as if they're struggling there while they are brushing. Like, hello, it's not death sentence now. Dr. Solu has said today, you have to sweep. And, place the toothbrush below you. Some people literally brush their... Guys, I can't help you guys at this point. If you guys are not going to follow what Dr. Tolu is going to just said right now, I think, your case is very, very different. Thank you so much, Dr. Tolu. But then again, what about people who have allergy to brushing? Because I've actually seen people who say that, they have all manner of allergies every time they use a toothpaste. What's the plan for them? How can they protect and keep the teeth clean?
Okay, so having allergy to toothpaste is not a very common thing. It's not very common. But for most of the people that have allergy because of a particular, which is called sodium lauryl sulfate, so it's one of the components in toothpaste that make people to be toothpaste. Also, some people may be allergic to the material used to make the toothbrush. So that's another type of allergy. So there will always be solutions for those who have allergies to certain kind of toothbrushes, maybe the latex toothbrushes. They can go to the ones that don't have that particular material. They can look out for toothbrushes that are not made with that material that they're allergic to. They can look out for toothpastes too that do not have those ingredients that they're allergic to. So first of all, they have to be sure of what they're allergic to, and then avoid toothpaste that have those components. The good thing is the component that people are allergic to is not the component that strengthens the teeth. It's not fluoride that most people are allergic to. It's usually sodium lauryl sulfate. And that's what makes the toothpaste to foam. So you can always use that toothpaste that doesn't have that component and that still contains fluoride and is still able to do the job. Likewise, the toothbrush too. You can avoid toothbrushes that have the components that you're allergic to. And if in doubt, you can always visit a dentist for advice on best options for each individual. But not brushing the teeth can never be an option. There's always a to juggle the toothpaste brush that works for each person.
That in Africa, there is always a misconception one way or the other. So now let's talk about, in your years of experience, right, what are those misconceptions that you have actually heard about, the teeth?
Okay, so people feel, so we're talking about brushing teeth with medium brush. Well, some people feel they don't use the hard toothbrush, have mouth odor. Some people feel it's with what they put brushing that and that's not true. So using the right teeth and the right texture paste and using the right toothpaste makes the mouth clean. Another common concept that you only dentist when there's pain. People come and are like, and they say, "Not be paining me. I've had this whole for a year plus for some." But the so you don't have to wait till pain before coming around. Some people feel if they've not used toothpaste, the food is like they feel like it's like the dessert. They must put it in their mouth. That dental floss are supposed to in place of tooth picks. Another very common thing for patients is doctor, if I start removing one tooth, will it not move? I think that's it. I hear, and I'll start removing. I'll keep it. I don't have any teeth in my mouth anymore. And I always tell them, continue what caused first tooth to be removed. Yes, all your teeth will be removed. But if you break the habit, stop taking food. If you make sure you brush twice a day, and second time, if you brush a fluoridated toothpaste, if you maintain all the, if you come every 6 months for your cup, if you have your skin, if you come early when you have any, you would have what happening to the breast. So such dental caries moves from tooth to tooth. Or that it's a worm. Some people say it's a worm that person hit, and that worm keeps going tooth by tooth until the person doesn't have. That's not true. Some people feel they can use mouthwash to brushing. But I've used my correct mouthwash. It's good. No, that's not true. Nothing can replace toothbrushing.
Wow.
Mouth is a complementary tool, better used when advised by a dentist, but all of this cannot replace brushing. It's a common thing I hear from patients on myths, on things they about their teeth or about their oral hygiene.
Wow, that's just a whole lot to take in. Ah, God. Thank you for, I mean, I like the fact that you started with the very most common misconception. And I will not lie, at some point in my life, I practiced it. The toothbrush has to be very hard. So when you want to go and buy toothbrush, you just first of all touch, where the brushes are to see how hard and strong, because there is this perception that the stronger the brush. Thank you so much. Thank you so much, Dr. Tolu, for that information. So the next question I'm going to ask right now is going to be for the children. And I know that they are going to be very excited. And I'm also going to be very excited, depending on the answer that you are going to give. Because as a child, they told us this thing a whole lot. So now I want to hear from the horse's mouth directly. Is there a connection between diet and oral health? Is there any connection? Does it mean that if we take sugary things, our teeth is going to fall off, or it has any side effects on our teeth?
Yes.
No.
Diet plays a very key role in dental caries. So there are 4 things that bring about dental caries: the diet, the food the individual is taking in; second, the tooth itself. So the tooth has to be present. That's to enabling diet, bacteria, and life has to be time over a period of time. Those are the 4 things that bring about caries. And so diet is one of the most important things, and that's the area that we can actually influence a lot. Apart from the oral hygiene, diet we can, and children are usually at higher risk because they tend to love sugary things more than older people, and they tend to come down with caries. You have children with early childhood caries. You have children with severe early childhood caries because they've been exposed to the wrong diet, or they've been breastfed the wrong way. Some mothers leave breast milk in their baby's mouth overnight just so they don't stress them. So they put breast milk in their mouth until they sleep off. And the milk there, they've forgotten that milk can lead to caries. That milk is a sugar medium that this bacteria can act upon. Children, 2-year-old, you see children, and virtually all are already affected. So yes, diet plays a very important role in dental caries, one of the key factors in dental caries.
So I'm sorry, children. I thought Dr. Tolu was going to be on her side, but apparently she said no. So if you're a mother and you take pleasures at feeding your children with sugary stuff, you have to really, really watch it, because at the end of the day, the side effects will come on their teeth. So, Dr. Tolu, I just want to know, when it comes to the body, they'll tell you eat beans so that you can grow. When it comes to the bones, they'll say, eat this so that, your bones can be stronger. But when it comes to the teeth, are there foods that you have to eat to make you have good teeth?
Yes. So generally, eating healthy. So what works for the body generally, the teeth is part of the body. So whatever works for the body would also work for the teeth. So generally, we say eat balanced diet. And in balanced diet, we will not add sugar and sweet things to the balanced diet. So those things will not make up the balanced diet. So eating balanced diet generally will keep your teeth strong, will keep you safe from dental caries. But I will emphasize on the area of fruits and vegetables. So taking fruits and vegetables keeps your mouth healthy, keeps your just the way it helps your body also helps your mouth to be healthy, helps your tissues generally to be in good form. Also, food rich in calcium, considering that the teeth is made up of calcium, is a very high part of the teeth. It's a very one of the highest minerals in the teeth is calcium, and so eating food rich in calcium. I know I said milk can cause dental caries if taken the wrong way, but yes, taking food with milk is a very good source of calcium, and that can be helpful. So yes, I think I should mention this at this point that yes, we know that some of this sugary food can lead to caries, so doesn't mean we'll stay away from it totally. That may not be feasible. But what can we do when we take these things? If you take water immediately after, if you can't brush immediately, you gargle with water immediately. And if you are at home and you have the opportunity, you brush immediately after taking these foods so that you don't completely lose out on the good parts of taking that food. You don't completely lose out from the nutrients that you can get from all of that food. So if you must take these foods, these foods that can lead to decay of the teeth, make sure to brush immediately or to take water immediately. So yes, milk is a very good source of calcium. Fruits and vegetables, highly advised. You should not go about breaking bones, but you can take meats, you can take fish, and all these other food that have a reasonable level of calcium. Then eat bowls that are so helpful to this.
People of God. Did you literally hear when Dr. Tolu said we should not go about breaking bones? Am I the only one that left the WhatsApp group? Because I don't know, some people can just chew strong, turkey bones. You see people crushing. You know how hard turkey bone is? And then you see people.
Yeah.
Okay, it's been said today, stay away from healthy, I wanted to say healthy bones, but then, bones from chicken that had fear of God. I mean, they don't really go through so much in life before, they got to your plate. Stop trying to struggle and let go. God, thank you so much for making that point, because it was literally on my daughter, and that was one of the things I wanted to stress on today. But then, Dr. Tolu, before I let you go, I'd like you to, give us insight into what is oral cancer and what are the early symptoms that someone can notice in their teeth, and then, reach out to a dentist for help.
Okay. So oral cancers are basically cancers in the mouth, abnormal growth in the mouth that can either be local or invade surrounding structures. So, and one of the early ways, or one of the ways we see oral cancers, one of the ways we see patients, the ways they present, are with swellings. We see a patient that comes and says, I notice this swelling under my tongue. I notice this swelling on my palate. Palate is like the roof of the mouth. Okay. I notice this swelling somewhere on my gum, my cheek, on my tongue, or things like that. I noticed that the bone, so the jaw is what holds the teeth. So they noticed that it seems like the jaw is getting wider. From outside of my face that it seems like the left side of my face is no more symmetrical to the right side. So these are common ways. So these are the common ways the patients speak. They say, I've noticed this started off like a being stage, like being over a period of time, started growing. It wasn't paining me, so I didn't do anything about it. But they come after 2 years and say, I started paining me now. I started to come. So what are the ways we see cancers present? First of all, swelling. It starts as small swellings many a times. So bleeding. It also be an area that feels like, okay, there's a bleed, there's an area that just keeps bleeding. Another way it could present is an ulcer. It's something we call stress. People assume that all ulcers in their mouth are stress ulcers, aptos. If there's any ulcer or some injury in your mouth that is not healing for days, any ulcer that has not healed within 2 weeks, any ulcer in your mouth that has not healed in 2 weeks is worth seeing a doctor for. You don't need to wait till that time. this ulcer, this injury in your mouth, so to say, is not healing. It's not changing. It's bleeding. It's just there, painful. You don't have to wait. Max 2 weeks. You are not seeing any change. You should see a dentist. That could be an early sign of a squamous cell carcinoma or anything like that. Do not neglect any. Don't say it is small. The best time to take it out is when it is small and before it starts spreading to surrounding. Because something on your face, it feels like my bone is getting down. Get to the right. Please come and see the doctor. Your cheekbone looks big. Just a difference. No matter how small, see the doctor and let them be the help with that. Nothing. Take a sample and confirm that there's nothing wrong. Another thing I should say quickly on oral cancers is some of the social activities that people indulge in put them at risk of oral cancers. Drinking alcohol excessively, especially, and taking tobacco. Taking alcohol excessively, and I would say taking tobacco. So there's nothing like taking tobacco small or big. It's a no-no. For alcohol, excessive alcohol puts people at risk. But if you can stay away from it, better. But not be taken excessively. Also, a lot of sexual is among the youth. People have sex things puts people at risk of having oral cancers. So that's something that needs to be also need to take note of. That oral sex is higher risk of oral alcohol, smoking. When I say smoking now, not just cigarettes, so people each other much deleterious effects. That they are all tobacco. They all have deleterious effects on the body. They all have nicotine, and they should stay away from as much as possible. Chewing, all sorts of things but most especially chewing, smoke, and anything like that to stay away from as much as possible. So yeah.
Thank you so much. Thank you so much for that detailed explanation. I mean, you literally had to snip into my script a little bit, but then that's very welcome, because I see people do a lot to their bodies, and sometimes, you just wonder, do you even know that there are side effects? Like, some people can chew chewing gum. In fact, not even some people. At some point in my life, I could chew chewing gum for a whole... We had, back in secondary school, we had this group of friends, and we could chew gum like 1 week straight. And we'll still be complaining of toothache, but, days of ignorance, we didn't really know so much. Thank you for making that clarity today. But before, we go, let's talk about the children and, the age people. So my question would be, when should parents start taking their children when should parents start taking their children to a dentist for their dental checkups? When? Is it when they are 1 year, 2 years, 3 years? And how often should it be? Could it be 6 months, in 3 months' time, or in 1 year time?
Yeah. Okay, so I think according to American Dental Association, the recommendation is that before a child's first birthday, that child has seen it. So the best time to take a child to the dentist is as soon as they have teeth, really. So from 6 months, you expect the first set of teeth, anteriors, to start coming up. So as soon as you see any kind of teeth, that's the best time. That's going to be before 1 year old. So before your child's 1 year birthday, make sure that your child has seen the dentist. Very important. So you get that information, prevent any of the oral diseases that are common in childhood.
Okay, so let's talk about the aging people right now. I know that as people age, your body tends to respond differently. Now, are there any dental, situations that you have to be aware of as you are, turning a new age?
Yes. So generally, like every other part of the body, as people age, as people turn 40, turn 50, that's when you start hearing of diabetes, hypertension, and things like that. Same thing with the teeth. These teeth have been in the mouth for so working, they are worn out compared to those of the other people. They've been used for longer, so they tend to be older than the ones that have been used for a shorter time. But does that mean that in old age, all you follow? That's not true. I think patients of over 70 and that's because they did the right thing early enough. So no such thing as with old age comes falling of teeth. That's not true. If you do the right thing, your teeth will still be complete and in your mouth, even at old age. So yes, they have a high of having one. The color might have changed. They may have time mouth. They may not have much saliva as before. They are gum. They have been with brush quite a while, so their gum may have started moving off. They may have moving up, have periodontal disease, so the structure holding the teeth in place. If they've not been doing the right thing through the years, they have higher risk of losing teeth at that age. But if you kept all the rules, you will not lose teeth at old age. So yeah, and one thing they can do is to keep themselves hydrated, because they tend to have dry mouth much more than a younger. They drink more water. They should make sure that they don't stop brushing and keeping up with their oral hygiene measures, and they will be good.
Okay.
And for those who lose their teeth, there are always options to replace them, so that they don't have to go around without the teeth. Even if they've lost all, we have provision.
Okay, thank you so much, Dr. Tolu. Now, before my last question, I promise you this is the last question. What would you consider, or what would you say would be your best, your best oral health advice that you could give to anyone about their teeth? What's your best that you could give out to us, like your Harvard best?
Okay, so I think the best advice I will give would be brush your teeth twice daily. And yes, I'm a dentist, brush twice daily. But more important than brushing twice, I would say right. So much more than the frequency, get it right. If you brush once a day, make sure you're doing it right. If you brush once a day and well, trust me, you're not likely going to have any issues. So yes, if you can brush twice a day, wonderful. But if I'm to give one advice, it would be brush right. So yes.
Thank you so much. I promise you a Las Vegas trip. I'm going to just go and research if, I know that Trump has really banned so many things. Well, let me see if, the trip I reserved for you will still be permitted. I'll get back to you. Thank you so much, Dr. Tolu, for being a part of this show on Wellbeing today. We really, really appreciate your presence on Spectrum TV.
Thank you for having me.
Yeah, bye-bye. Okay, so we've been having a very interesting conversation with Dr. Tolu. And I mean, trust me, while she was talking, I don't know about you, but while she was talking, I just kept, and especially when she talked about brushing of the teeth, I mean, she said you have to sweep. So I had to be sure, have I been sweeping? Because there's some of you that hold the toothpaste like this, and if the teeth could actually speak, right, or take some of us to court, you'll be seeing the teeth as, this person has been dragged to the court because of abuse of the teeth. Hold the toothbrush normally, and guess what? Just because your toothbrush is hard doesn't mean that you're brushing your teeth well. And it's not how many times you brush your teeth, it is how right you brush your teeth. She said sweep, so gently go left, right, up, down, up, down. All of you that hold toothbrush like this, and then you pull out your tongue, and then you scrub your tongue like someone who was just released from prison after like 500 years. It is very, very wrong. And if you notice, when you're done with all those drama, you get to feel some pains in your chest because you're literally rupturing some nerves in the process of trying to clean what's not even dirty. So please be kind. Be kind. How you brush your teeth will tell how you take care of somebody. Because if you can hold your toothbrush like this and injure your gums, imagine I don't want to say what I want to say, but then I had a friend that, used to say that her worst nightmare was when the father brushes her teeth because a whole lot comes down. And guess what? If you hold your teeth like this and you're brushing, imagine if your sister brings, her daughter or her son to you. Imagine what you would do to that boy's teeth. You just do what you used to do, and that's very wrong. Above all, drink water. Go normalize going to see a dentist. Don't assume that just because your teeth are white, everything is okay. It's okay. Just walk up to any hospital and talk to a dentist. It's not that expensive. Thank you so much for being a part of today's show on Wellbeing. I told you that on Spectrum TV we prioritize you at with all our hearts. Imagine how much you could have paid to get all this information from a dentist. But here we are, we brought it to you in a platter of gold. And that's to say that it's something that we take pleasures at doing every time on Wellbeing. My name is Emma John James, your health anchor on Wellbeing. I'll be right back, same time, same station, and guess what we're going to talk about today. But before I go, this is also your show. If there is a topic you wanted to talk about, you have a question in your heart and you want to reach out to a doctor, all you have to do is go to our social media handles at www.spectrumtvlive.ng or anywhere on Facebook, Spectrum TV, Instagram on Spectrum TV, and we will answer your question as soon as possible. Thank you once again for spending your last 1 hour with me. I really, really do love you. Take good care of yourself. Bye-bye.